My name is Mariana Matus. I am CEO and co-founder of Biobot Analytics. I co-founded Biobot back in 2017 with a mission to transform wastewater infrastructure into public health observatories.
In any given city, the largest source of mass moving in and out of the city every day, it's not cars or trucks or container ships, it's water. And essentially pure water is being pumped into the city. Everything that we do in a city leaves an imprint on the water that leaves the city every day. And so the idea is, can we mine that to collect information that might be valuable, especially for public health, based on what we see there.
We started with doing wastewater testing for COVID with Biobot in March of 2020, when things had really just started here in the Boston area. They were doing a study in Cambridge. They said, hey, we think we can test for this in the wastewater. Can we get samples? We provided those, and they used those to do the first published detection in the United States of the COVID RNA in the wastewater.
If you think about it, your waste is going down the drain through your house, connecting with the city sewer outside, where it's actually mixing with sewage from tens of thousands and hundreds of thousands and sometimes millions of other people before it ends up at the wastewater treatment plant. And it's this environment that is like layers deep under our cities, and it's this like vast network of information. Actually, at Biobot, we call it an information highway that is untapped underneath our feet.
I think what's amazing about Biobot and amazing about what Mariana was able to do was, what we were doing under the hood was very complicated science, and it was not straightforward. But what we were doing is very intuitive, right? Things that go into our body, whether it's things we eat, disease, drugs we take, come out, and we can look at that sort of holistically and make better public health decisions based off of it.
Her company was the first company to actually use wastewater surveillance during the COVID pandemic, and the CDC came to depend on it.
COVID was a crazy, crazy time to be scaling up a company. And I mean, we would get calls from governors, like not governors' offices, like governors, being like, where is this data? And I think for us, we understood how important the moment was, and that we were really trying to meet the moment as big as it was.
We got pushback early on against making the wastewater data results public. If you are using the restroom, you are contributing and getting counted on this data. So I thought it makes sense, if everybody's contributing to this public resource, that they can also see it. And secondly, I highly believe in trusting people, in believing that they are smart, and that we as experts don't need to hide information just because maybe we don't fully understand it.
One of the things I came to learn about Mariana is I knew she was smart, but I also knew she had this incredible perseverance and tenacity that not many have. She followed a pursuit of something she really cared about, and this was all around public health. And she did it because of her relationship with water.
I grew up in the outskirts of Mexico City. We grew up in poverty. I got just to see the very wide inequity that exists in the world. Why didn't we have the basic services? Why didn't we have clean water? Why didn't we have proper wastewater infrastructure? But other parts of Mexico City were luxurious and had everything. And that just really bothered me. And I realized, well, I don't know what I can do about it, but at least in my small way, whatever I'm doing, I'm always gonna think about those people and those communities that tend to be ignored.
Getting to know Mariana, I realized that although she's doing this now, Biobot Analytics, wastewater surveillance, she's so curious that I'm convinced that she's gonna have so much more to do and so much more to give.